You need to know your enemy, and you need to know what tools they are coming with or what weapons they're coming with. So the first part is to understand what type of questions you're going to get, how the GPhC structures these questions, what exactly to look forward to or watch out for in each question. And I'm going to show you the techniques and strategies to answer any type of question. Any type of question. Right? So the first thing I want to do is I'm going to show you exactly the structure of those questions, how the GPhC actually structures questions. We're going to look at who actually sets your questions, and so that you could see exactly what they use to set these questions. So these are something that you probably don't see anywhere. You are in the right place today, ladies and gentlemen. I'm excited for you. Today, I'm going to go through techniques with you. We're going to dissect each and every GPhC style question, and I'm going to show you how to answer them confidently. Number 2, day 2 tomorrow. You don't want to miss tomorrow. What we're going to do tomorrow is I'm going to show you the difference between recall versus analysis type questions. This to me is the key to pass the exam. You need to know the difference between GPhC recall questions and GPhC analysis and sort of interpretation questions. Previously, in previous exams, many years ago, when I did my exam, most of the questions were recall questions. But a lot has changed. More questions now are actually analysis questions, questions that involve comorbidities, questions that involve you using different strategies. These are questions that have more than one plausible answer. These are the questions where you look at them and you say to yourself, wow, I am confused between A and B because they look similar. These are practice-based questions. They're the questions that ask you about the most likely, right? The most, that means the best of all these options. But today, guys, you don't have to worry about anything. If you stay with me, you're going to love this. So we're going to do this, and I'm going to show you questions, GPhC questions, and I'm going to show you all of these things to look out for so that on the day of the exam, you're absolutely laughing. You're going to feel so confident. You're going to walk out of this place, and you're going to do questions differently than you've ever done them before. In fact, you're going to see this exam differently. That's my goal, is that you see this exam differently than you are actually seeing it right now. And the truth about it is, this exam is not as bad as you think it is. And your mocks do not do you any justice. And I'm going to show you why you shouldn't really look into mocks very much, because they are nothing like the actual GPhC questions, because they don't go through the same processes. So day number 3, you don't want to miss that either. So we're going to go through more questions, and these are going to be harder questions. Right? When I say hard, I'm not trying to scare you, because it's not just about giving harder questions. I'm actually showing you techniques on how to do harder questions as well. Right? So everything's going to be fun, everything's going to be easy, everything's going to be applicable. Right? I'm not about telling you, I'm about showing you. Right? So I want you to have a skill. So here's what I'm doing for you today. Right? You've all heard about this. It's better to teach you how to fish rather than give you a fish every single day. Right? It's better to teach you how to feed yourself as opposed to giving you food every single day. If I did a session today where I just gave you questions, answers, questions, answers, questions, answers, I'm literally feeding you every day. But if I teach you how to answer any question so you have the skill, then I've fed you for life. So today's session is about teaching you the skill so you walk away from here, and it doesn't matter whatever mock paper you look at, whatever exam you do, whatever thing you do in practice, you'll be able to do so well. The 4th day, you don't want to miss that either. We're going to look at SPC questions, but it's all about strategies, okay? It's all about how to answer SPC questions effectively, how to do them quickly. You're going to have lovely Georgina. Georgina had 100% in calculations, and she had 98% in her clinical exam. She's going to show you how to go through SPC-style questions or abstract questions very quickly. Day number 5, we've got man like Umar with calculations. How many of you struggle with calculations? Give me one, give me one, give me one. Type of me. Let me go into the comments. How many of you actually struggle with calculations? Let me see. If you struggle, give me a me if that's you. Calculations is the one thing that you're a bit scared of. For this exam, give me a me, type of me in the comments. 370 of us on here. Wow, this is amazing. You guys will all pass. I love you. I love your determination. I love your determination. So we're going to have calculations, and I'm going to show you again strategies. And then day number 6, guys. Day number 6 is such an important day. On day number 6, we're going to show you how to use the Surpass system and its functionalities. So because this is the thing, and I'm going to show you guys later. You could learn everything you want, go through your BNF, go through all the calculations, your NICE guidelines, you do the whole GPhC framework, but you still walk into that exam and fail the exam. because you've not prepared for the exam day itself. So many of us focus on questions, revision, but we've not really looked on how to use the electronic system on the day of the exam. I have students in the past that have actually struggled and they failed the exam simply because they did not really familiarize themselves with the system. But that's not going to happen to any of you, because Raheem is going to be here and is going to go through the key things you need to know about the system. So when you walk into exam, it's easy. He's also going to look at more critical thinking techniques for you, because that's really what you need now. What you need is critical thinking. You don't need to be taught about more things, about more content. What you need is teaching you how to think critically, which doesn't take long. And then the final day, which is day 7, I'm going to be back on here, which is Sunday next week. And we're going to focus on your exam day checklist. So everything I need to have in preparation on the exam day itself. I'm also going to have lovely predictions for you. So anyone that's been to any of my sessions every year, I always give a number of predictions and they always come. So on that last day, we're going to go through exam day checklist. We're going to go through exam predictions for you. We're going to go through a lot of motivation, because that's really what you need. How to reduce your anxiety. I'm going to give you some lovely, lovely performance tips for the day of the exam. Okay, so how many of you are excited? You're ready to go? If you're ready to go, give me a 1, give me 1, give me 1. If you're ready to begin, give me 1. This session is going to change your life. This session will absolutely change your life, and it's going to give you a very high chance of passing the exam. Are we ready? Give me a 1. Are we ready? Nicole is ready. Haley is ready. Haley Dench in the house. How are you, Haley? Zenya's in the house. We're all ready. Lena, great stuff. Gulsum Maiden. I've got to give a special shout out to Gulsum. Gulsum, the one and only Gulsum. Okay, let's do this, guys. Let's go in. These are very important things, so I'm going to take my time and I'm going to make sure you learn this, okay? So let's go to each slide. Can you guys all see the slides? Are they clear? I know it looks a bit smaller on my screen, but let me know if you can see the slides clearly. Perhaps I'm going to make that a bit bigger. Okay. Can we all see the slides? Give me a yes, give me a yes, give me a yes, and let's go straight into this. Day number 1 of the 7-day training program. So here's what we've got for you. So the agenda, a bit about period shortcuts, 2 seconds, and then the 5 keys to pass your GPhC registration exam. There are just 5 things. There are 5 keys to pass this exam. Right? And I can promise you, if you follow these 5 keys, there is no way on earth you're going to fail this exam. You will pass the exam. And then finally, we'll look at 1 or 2 questions to end this, because we're going to continue more questions tomorrow. We're going to look at recall questions, and then I'm going to show you the difference between recall and analysis questions so that you become so good at these 2. Okay, so about me very quickly, some of you don't know me. Who's here for the first time? Who doesn't know me here? Who's never seen me, never heard of me? Type of me. If you're new to this place, never seen you, don't know you, Marvin. I just joined because my friend asked me to join. If that's you, then just a bit about myself quickly. I'm a community pharmacist manager. I've been that for many years. Superintendent pharmacist, BBC Media pharmacist. I'm an author of a book, Success Secrets for Students. I've always worked with students, always been interested in supporting you. I'm a personal trainer, media expert with Jake Runs, international keynote speaker. I'm also the managing director of Previous Shortcuts and co-owner with Uma. And in terms of the awards, I've had many awards. Community Pharmacy Manager of the Year award, voted as one of the top most influential pharmacists by the Chemist and Druggist magazine. Last year, our company was nominated finalist for 3 awards, online training by the CMD. I received a nomination for the Above and Beyond individual, and also I'm a natural bodybuilding champion. Okay, so I've been doing this for many years. I've helped so many students succeed, 100 of students succeed, and I know 100% I can do that for you as well, and I will do that for you as well. Okay, so here are the 5 keys, guys. Write this down, take a screenshot, do what you can, but this is the secret. So I posted this not long ago on LinkedIn. It's so important that you understand this. So these are the 5 keys, and if you go through each of these, and this is exactly what we're going to do for the next 7 days. And that's why I say to you, don't miss a single day. So today we're going to look at understanding the GPhC framework quickly. And then day 2, which is tomorrow, I'm going to show you how to apply your knowledge in the exam in a timely manner. There are some key words you have to look at here, and this is what I'm going to show you. And let me see if I could circle this. Apply. This is so important. The GPhC exam is not just about recall. Right? You can learn every single thing, memorize the whole BNF, but you still struggle to answer questions. How many of you have read topics, but you still struggle to answer questions when you see them? Like you've probably read this chapter, you've done the cardiovascular system, but when it actually comes to answering the questions, you struggle. Give me a me if that's you. Give me a me, give me a me. If that's you, like, I don't know, Marvin, I've done the CNS, I've done the cardiovascular system, but when it comes to actually answering questions, I struggle. Okay, so if that's you, then you'll be very happy because today, and that's what it's all about, I will show you the reason why, and I'm going to show you how to sort that out. It's not just about recall, it's about learning how to apply. Okay, and that's exactly what we're going to be doing this 7 days, is showing you how to apply your strategies. Okay, another thing that I have on here that many people don't tell you about, I'm circling this as well, is timely manner. It's important for you to realize that this exam is not just a test of your knowledge, it's a test of speed. In fact, we've had years when some students have said the exam hasn't been difficult, but the time was a challenge for them, right? So time is so important. Everything you do, you are tested against time. All right, so I'm going to show you how to maximize your time. Number 3, it's understanding, and this is so important. No one really focuses on teaching this, and so that's why I'm teaching you this, because all of you will see by the end of this program how confident you're going to be in terms of answering questions. The reason why many people are not confident is because they don't understand prioritization strategies and critical thinking strategies. But you don't have anything to worry about, because that's exactly what I'm going to do for you in the next coming days. Once you get that out of the way, you're fine. The next thing is your numeracy skills. It's a test for your calculation skills. Calculations is important. You need to be able to do your basic calculations to pass the exam. So that's the 4th key, is to learn your calculations. The final one, you could learn, and this is so important, you could do 1, you could do 2, you could do 3, you could do 4, you could understand the framework, you could learn how to apply all this knowledge, you could know all the prioritization strategies, you could learn all your calculations, but if you don't do 5, you still walk into the exam and you could fail the exam. Let me give you guys an example of what I mean. How many of you, when you are at university, you remember a time when you went to do an exam that you've done all your revision, you actually knew the stuff, but on the day of the exam, you don't know what happened, you actually forgot the stuff? Give me a yes, that's you. You only remember when you walked out the exam. After the exam, like, oh my gosh, I can't believe I got that wrong. Oh my God. Now the answers start coming to your head. If you've had that before, give me a yes, give me a yes, give me a yes, give me a yes. Great stuff. Great. Oh yeah, man, just on there. Sorry, I just noticed that. I think someone said, oh, sorry about that. Let me take that out. All right, sorry about that. Sorry about that, guys. Because I keep going to the screen so I can't see your comments, and then I come back. So yes, so that's what I mean. So what I don't want to happen to you, and that's why we're doing this last session for you, the mental and exam day prep, is because it's your mental state on the day of the exam determines your performance. So if you walk into exam nervous, maybe you did not take all your documents in, you don't know how to use the system, you start having all this anxiety, then you could fail the exam, right? And we don't want that to happen to you. Right, so I'm going to make sure that that doesn't happen to any of you, okay? So that's why the last day, mental preparation and exam day tips is so important as well. If you combine all these 5 things, you will totally smash the exam. And that's what we're going to do for next semester. How many of you want to pass the exam? Type of me if you want to pass this exam. You're here because you want to pass the exam. Type of me, type of me, type of me. 387 of us. Let's get to 400. Let's get to 400. Get the people on here. Share this. Hit the like button. Let's get this. Me multiple times. Go some. How you doing? Yeah, like go some in the house. Okay, let's go in. So we're 392. Let's get to 400, ladies and gents. Okay, so let's do this together so that you guys get the best out of this session. So we know our 5 keys. Please remember these 5 keys because this is what we're going to do for the next 7 days. So let's go. Key number 1 is you need to understand the GPhC framework. Why? Can anyone type in why we need to understand the GPhC framework? This is the most important first step. Is there anyone that hasn't seen or heard of the GPhC framework and that's doing the exam the next few days? If that's you, type on me. I just want to make sure all of you have seen, looked at the GPhC framework. So why is this so important? It's because all your questions, guys, mark my words, all of your questions, not some, all of your questions in the exam will be from the GPhC framework, right? All your questions. I'm going to give you guys good content. You might hear some students talk a lot of rubbish, and there are many people that say a lot of wrong things to you. Oh my God, the exam was so difficult. They gave questions that were not even part of the GPhC framework. That's a complete lie. And I'm going to show you why, because there is a structure to the way questions are set by the GPhC. Okay, and I'm going to show you guys that. That's why I said to you, you need to understand the structure. If you understand how a GPhC sets questions, then you have a higher chance of smashing these questions. Okay, so Cisa Sekozi says you need to do this to understand what they are examining. Right, so you cannot go to war without knowing your enemy. Right, so this is exactly what we're doing now. I'm literally helping you understand the mind of the GPhC and the people that set this exam so that you know what to focus on. Okay, so 401, fantastic, well done. We hit the big 400. Let's keep going, listen, gents. It's going to be a great session. It's going to be fantastic. So many golden nuggets for you. So here is an analogy that I use. So the GPhC exam is a bit like driving a car. How many of you have got your driver's license? How many of you drive? If you drive, give it me. Type of me. How many of you actually drive? How many of you drive? Right. So you've done your driving test, you've passed, and you drive. Type of me. So the GPhC exam is a bit like your driving test. Right. So you know on the day of your driving test, your instructor doesn't care how much you know about how the car functions internally. They're not really bothered about whether you're an expert on how to design the engine of the car or how your car engine works. All your instructor is bothered about is that you're able to drive the car from A to B safely. Okay? All they care about is that you're able to drive that car from A to B safely without putting anyone at risk. This to me is exactly what your GPhC exam is. They're not testing you. It's not a doctor's exam. They're not trying to get you to be an expert. You don't need to know the entire GPhC framework. You don't need to know the details of pharmacology and pharmacognosy and all these things. You don't even need to be a calculations expert. They're not testing you on all of these detailed things. What the GPhC is trying to find out is that you as a trainee and as a pharmacist on day one, you're able to work in the pharmacy safely and effectively. You're literally able to go in there, perform your duties without harming a patient. They're not trying to test to find out if you're an expert in biochemistry. So that should give you some confidence, guys. You don't have to learn so much detail. You just have to be able to practice safely and effectively as a pharmacist. This is the reason why many of you, when you do mock questions tend to be harder sometimes than the GPhC exam. One of the reasons is because some of these are detailed, but the exam actually just wants to test you on common day practices. They're not testing you on your knowledge of the entire BNF. They're literally finding out the common things that happen in your pharmacy every day that you do. They just want to make sure that you're able to do these things by yourself effectively and safely, right? So that's why when you walk into the exam, many of the questions will be based on things that you do on a day-to-day basis. Okay? HS says, I feel like so many students know so much detail. Yes, so you learn so much detail, but that's not really, of course you need to learn, you need some of that detail, but what I'm trying to show you, the main test for this is to make sure that you practice safely. They're testing you on your day-to-day things. All right. So it's so important that you know that so you don't start stressing and spending all the time trying to memorize the entire BNF when they're going to ask you questions based on your dispensing practices. Questions based on, we could look at the MEP, but most of those questions that they're going to give you on the MEP won't necessarily be just questions that you have to read. There'll be things that you do daily in your pharmacy, your controlled drugs and things like that you do daily, you dispense. They're going to ask you questions on antibiotics. It doesn't necessarily have to be a question where you have to read the BNF to know it. Or be just things that you do because you've been dispensing and you've been doing your SOPs and you've been doing all these daily things. You've been doing some things in the pharmacy, some tasks in pharmacy, your dispensing tasks that you do every single day. They will test you on this, on campaigns, on health campaigns and things like just to test your knowledge, okay? So this exam is related to your daily practice. More of your daily practice than just memorizing all these textbooks and all this information. So please remember this. The next thing I want to show you is this. This is from the GPhC, okay? So the registration assessment is one of the ways, so it's not the only way. It's just one of the ways that the GPhC is going to test you to make sure that you can demonstrate that you understand how to apply. So these are not my words. These words are from the GPhC. Okay, this is from the GPhC. So if you look on here, we've got how to apply is so important. The testing you on application. This is the reason why for the next coming days, I'm going to focus on teaching you how to apply your knowledge by showing you some strategies. Okay, so this is the first thing that the saying, right? Apply. The next thing that GPhC has for you is timely. Time is key. Is there anyone that needs extra time in the exam? Please make sure that you've requested for extra time. Okay, but time is important. There are many trainees that failed the exam, not because they didn't have the knowledge, not because they didn't know the stuff, but simply because they ran out of time. So the GPH is also testing you on your time. They're trying to make sure that you can make a professional judgment. So most of the questions that we're going to look at, which are your analysis questions, are based on judgment questions in the pharmacy practice. And then finally, it's also test your number sense calculations. So 1, 2, 3, how to apply in a timely manner, professional judgment, number sense. Very important. Guys, this is it. Right? This is really the key. And that's why we're going to focus on this. I'm going to really break down everything for you like you've never seen before. And it's going to make so much sense and you're going to be so confident. So this is so important. So why do we actually have a GPhC exam? Why do they do the exam? What is the point of doing an exam? Right? What is the purpose? Because it's not the only way to test you, because it's clear on here. It's just one of the ways to test you. But the main reason why the GPhC is doing this exam, or why you do an exam, is just for the public and for patients. Right? We do this exam because of the public and the patients. We just want them to have the assurance that you can practice safely and effectively. Okay, that's why we have an exam, so you can get on the register. And that gives confidence to patients and to the public that because you're on this register, you can practice safely. Remember what I said to you guys, safe is so important, safely and effectively. When we start doing some of the questions, I'm going to show you how to answer questions based on safety. The GPhC just wants to make sure you go for the safest options. And we're going to show you how to do that. All right, so this is the reason why we have the exam. So next thing, I'm just going through this quickly, is your assessment structure. Does everyone know what paper 1 and paper 2 will be like? I'm assuming you all know, those of you doing the exam. Okay, so quickly, paper 1 is obviously your calculations. You've got 40 questions. And you don't need to get every question right to pass, by the way. All right. Now, another thing I'm going to tell you is this. More students always pass the exam than fail the exam. And there isn't a specific pass mark. Now, everyone says 70%. I need to get 70%. Is this true? Yes or no, guys? Let me know. Do you need, what is the pass mark? What is the pass mark for a GPhC exam? What is the pass mark for a GPhC exam? So everyone says 70%, but it's not. Okay, so the exams, you may have some papers that may be slightly harder than others, but the standards are always the same. What I mean, so you might have a year where the exam may be slightly harder, but what the GPhC does, you see effectively, is that they're going to change the pass marks. So those marks change to balance things out so that everyone has a fair exam. Does that make sense? So you may do a paper, you may look at a GPhC paper, and that was very hard. You go, wow, that's a very tough calculations. But in that year, they may have had maybe slightly harder questions, but the pass mark in that year was lower than the other year where you had maybe they look slightly easier, but then they were higher. Does that make sense? So if you look at what was the pass mark for November calculations exam, the most recent exam? Does anyone know what the pass mark was for calculations for the November exam? What was the pass mark for the November exam? The one that went past, November 2022. Anybody know? Right, so yes, so it was literally about, what was it, about 50-something%. Right? It was about 50-something%. Okay, so it just goes to show that it's not really just 70%. It will also depend. They're going to assess those different things. So why am I telling you this? Because I want you to feel confident. Because perhaps you may have seen some papers, some questions that look difficult, and you're going to, oh, this was a tough question, so the exam is hard. But it's always in relation to the pass mark. But one thing the GPhC will always do is they'll always try to make sure it's the same standard so that every single person does it at the same level. Okay, so it's so important that you know that it changes different years based on the performance in the exam. Okay, so we have paper 1, then we have paper 2, guys. This is my area of expertise. So 120 questions split into your single best answered questions and your extended matching questions. 90 of those questions are SBA questions, single best answered questions. What does that tell you? You need to understand this stuff inside out. You're going to get 90 questions will be single best answered questions and 30 will be extended matching questions. Right, so I'm going to show you exactly how to go through those questions. So the assessment weightings, most of you know this already, but I want you to look at this, and I'm going to circle this so that you see, this is from the GPhC website, by the way. Everything I'm showing you is from the website. Okay, I'm not making things up, and I'm not just going with the flow like someone heard this. I heard this from somebody. You could check all of this on the website. Okay, so all the questions, not some of the questions. Guys, this is so important. All questions in the exam and the assessment are derived from the assessment framework. This is why I told you the first key is the GPhC framework, because all your questions will come from this framework. All your questions will come from the framework, and I'm going to show you guys how the GPhC sets questions, and then that will give you a better understanding of what to expect. Okay, and then many questions, so different outcomes, but this is what I want you guys to see as well. Many questions in the assessment concerns patients that have comorbidities. So most of your questions will be patients that have more than one condition. And this is where students struggle. That's why analysis questions are more of these type of questions. Hence the reason why you need to know the difference between a recall question and analysis type questions. But I'm going to show you all of this, guys. You will be so good. This is like teaching you've never seen before. I promise you. So your weightings, as you guys know, high weighting, 70%. That varies. So I'm looking at between 65 to 70%, 25 to 35% with medium, and maybe 5 to 10% low weighting outcomes, okay, of your GPhC framework. So guys, remember, all your questions will come from the framework. And the reason why I know this as well is because I'm going to show you how the GPhC actually sets your questions. How many of you like to know how questions are set? Give me a me, give me a me, give me a me. How many of you like to know how answers are set? Give me a me, give me a me. It's so important. It's so important that you know this. So please feel confident. Exam is not that bad, right? Especially in June. By the way, did you guys know that every year in June, without fail, go all the way back to 2011, every June exam, you've always had above 70% pass rate, right? That means 7 out of 10 students have always passed this exam in June. And of those that failed the exam, most of them failed by maybe 1 or 2 marks. And when you speak to them, the reasons why they failed was not really because the exam was difficult. Most of them was because they had other personal things going on in their life, right? So maybe lost a loved one, I wasn't well, I had a very tough placement, I had no support. These are the things that made them not pass, as opposed to the exam was just so difficult I couldn't pass. So is this clear? Great stuff. So let's go to the next thing for you guys to see, because this is, again, very important. Each slide is important. What I want us to do is to analyze how the GPhC questions come so that you're able to tackle them, right? Head on. I'm going to show you how to do this stuff. So this is going to be different from your mocks. And this is where I'm going to tell you, forget about all these mocks. Some of you are getting scared because you've done a Bradford mock, or I've done a period shortcuts mock, or a ProPharmacist mock. Don't even worry about this, because these mocks are not going to be a real reflection of your actual exam. In fact, many students that fail these mocks go on to pass the exam, including myself. Okay. And this is the reason why these mocks are different from the GPhC questions. And so when you walk into the exam, you will find out for yourself when you start doing the exam, like, oh, wow, these questions are different than the questions I was doing in mocks. And this is the reason why. So single best questions, we're going to start with your SBA. Why are we doing single best answered questions first? Because how many single best answered questions are you going to get in your exam, guys? Type in the comments. How many questions, single best answered questions, are you going to be tested in your exam? How many of them? How many single best answer questions are going to come up? 428 of us. Wow, that's a big number. Great stuff, ladies and gents. 90, right? Is this important, ladies and gentlemen? Let me know. Is it important that we diagnose SBA? We understand this stuff. We break it down. Type a yes if you think that's important. 90 questions out of 120 will be single best answered questions. And then third will be extended matching questions. So let me break this down for you before we start answering questions. So I told you this is going to be a session like you've never seen before. We're not just going to go and jump into questions. We're going to teach you how to answer those questions. So once we start answering the questions, you know exactly what we're talking about. So the first thing is this according to the GPhC, this is the difference between GPhC questions and all these nonsense mocks that we've been doing. Right? I'll call them that. I don't have, like, really, let's focus on the GPhC now. Okay. GPhC questions. So number one, there's always going to be a scenario, a question, and then 5 options. Right? Scenario, question, 5 options. The scenario in a GPhC question compared to probably most of your mocks is number one, the scenarios always have to be very clear and they have to be concise. Now, ladies and gentlemen, you tell me, those of you doing mocks, how many of you have done mocks where the questions are not clear at all? They're not really concise. You see many mocks out there. You're doing it and go like, why is this? Why is this answer this? This doesn't make sense. This is not too clear. If that's you, give me a yes, give me a yes, give me a yes, give me a yes. Give me a yes. If you've been doing those questions like, gosh, I'm looking at these questions and some of them just don't make sense at all. They're not clear. Now, the good news for you need to know, because these guys don't set questions like the GPhC does. Rand says a lot of them, so many, right? So you guys are all confirming what I'm saying. This is why I'm doing this session with you. Erom says so many, yes. This is because the mock questions do not set questions like the GPhC. And I'm going to show you exactly why. So the scenario has to be clear and concise. It will always be clear and concise. Content contains all the information. So in this scenario, which I'm going to show you guys later on, all the content to answer the question is going to be in the scenario, right? All the content you need is going to be in the scenario. There are some mocks out there where the content is not even in the question that you need to answer the question. But in the GPhC exam, you have everything in the scenario. Right? Negative wording such as no or not will be in bold, right? Not to confuse you. These are the stars. This is how you write the questions. And that's why you see most of these questions in the mock are not even in line with what the GPhC actually does, right? The next thing is the question. So the question is always going to be in bold letters. And I'm going to show you guys a technique where sometimes I say you start with the bold before you go to the other. So you look at the question first before you go to the scenario. But the question is always going to be bold. And negative wordings like no or not is going to be in uppercase and bold as well. Probably most of your mocks will never have that, right? But the GPhC is going to highlight if there's anything negative, like this is not this, they're going to highlight that for you if it's in the question. And then finally, you got 5 options. The options are always going to be in alphabetical order and it's going to be lowercase. The content is short and concise usually. So this, what I'm showing you here is not from me. This is from the GPhC. And they have standards in the way they set the questions. And that's the reason why you see many people failing mocks, but they go into exam and they literally smash the exam. Right? Because questions are clearer, they focus on a specific structure, and you'll be able to smash it. So let me show you guys an example, because everything we need to do with examples. So here is 90 of your questions will be short answered, single best answered questions, 90 of them. So they will be in this sort of structure. So let me put this, let me get my marker pen. So this here is going to be in every exam. The first thing we look at is you're going to have a scenario. Okay, I'm going to draw this round. You're going to have a scenario. And in the next coming sessions, I will show you exactly, guys, what you need to look up for in each scenario. All right, I'm really going to teach you guys how to break down a GPhC question like you've never been taught before. SBA, right? Single best answered questions. The first thing is your scenario. That's the scenario. Then the next thing is always going to be black. It's always going to be in black in the exam, right? This is your question. You only have 3 parts to this question. Only 3 parts. You've got the scenario, you've got the question, and then you've got the 5 options. And they're always in lowercase. They're always in lowercase, and they're always going to be alphabetical. All right. So this is so important for you to know the structure of the 90 questions that you're going to get in a few days' time. Because by understanding the structure, you will then know how to break things down in the exam, and the way you think about questions will be different. You're going to be walking to exam thinking, where is the scenario? Where is the question? Where are the options? And then I'm going to show you what to look at each of these with strategies so that you could do this stuff in no time. Are you guys still with me? If you're with me, type a yes, type a yes. If you're learning something new, type a yes, type a yes. Because today is learning about the structure And the next coming days, we will be going into detail on how to apply all of this. Move the chat, please. Oh yeah, Temi. Let's take that off. Sorry about that. So that's what we have. Did you guys all see that? Great stuff. So you have your scenario. Let me take my pen here. You have the scenario, which is this. You always have a question. It's going to be in black, bold in the exam. And then you're going to have 5 options. And these 5 options are going to be in alphabetical order. 90 questions. Okay, so that's your SBA. So then you're going to have your extended matching questions, which are 4 parts. I call them TIAs. Right? Not in that order, but TIAs. Just a good way to remember things. Right? The first one is SB5, and then this is TIAs. Right? SQ5, which is scenario questions and 5 options, SQ5. And then extended matching, I just call them TIAs. Okay, so the T is for a theme. So you always have a theme, you have an instruction, you have an answer, you have a scenario. You have 30 questions from this area. Now, this is what I'm going to show you. Once we start answering these questions, you will see the difference between a recall type question and an analysis type question. And you're going to notice that with extended matching questions, sometimes you have more than one plausible option. That's why people get stuck. But I'll have to show you examples, then you'll understand what I mean. And we're going to use GPhC questions to show you. So this is an example of your extended matching question, and you have 30 of these. Okay, so number 1, when you're looking at these questions, the first thing you're looking at is there's going to be a theme. This theme could be drug interactions. This theme could be side effects. This theme could be electrolyte abnormalities. Any of this. So always remember there's going to be a theme. This is going to be a standard. This is in all questions because you could use these options once or more than once. And then in all these questions, again, you're going to have your scenario, which we're going to dissect. We're going to analyze. I'm going to show you exactly how to focus and how to get the best answers from the scenario. Remember what I said to you guys before. Every single thing you need in the question is going to be in the scenario, right? So I'm going to teach you. It's all good. It's all good, guys. You don't have to worry. You are in the right place with the right person at the right time. And the next thing is you have your question, okay? Select the most likely. When we come to this later on prioritization strategies, you're going to understand that this most likely, most suitable, the very, very important keywords. But we'll look at that tomorrow and the day after. Okay, so are you guys with me to this stage? Give me a me, give me a me. If you're with me, give me a me. Remember, this session is not about content. I'm not here to teach you content. I'm not too bothered really about this is the right answer, this is the wrong answer. I'm here to teach you how to think critically and how to apply prioritization strategies to answer your GPhC questions. Because if you guys go onto the GPhC website, after every exam, the GPhC, the board, right, the assessment board will always put together the areas where students struggle the most. And one of those areas are always around the area of analysis, referral type questions. So I'm going to show you guys how to answer those questions. Okay, so please understand. So someone says, Shaba says, there were only 6 options there. I didn't nominate 8. Yes, they nominate 8. I think I just caught a bit under. But when we get to the questions, obviously you have 8. This was just to show you just the structure of the question, okay? So don't worry about that. We'll do questions later. But yes, you have 8 options and you see that in the questions. So is everyone clear with the structure? Give me 1, give me 1, give me 1. I want to take my time, make sure that you guys get this stuff. So 430 of us on here. Share this with your friends. Invite your friends. Invite your colleagues. Because this is going to really change things for them. By the end of the 7 days, you'll be amazed how confident you're going to be. In fact, some of these strategies, you can start trying them today. And you start seeing how good you will be at answering questions. Okay, so let's go on to the next one. The next slide is this. This is so important. Many people don't know about this. This is how your exam is written, and this is who writes your exam. So remember I said to you guys, we need to know the enemy. I call them enemies, but they're not really enemies, right? So don't take that literally. The GPhC is not your enemy, right? But it's just an analogy for you to know that you're going into war and you need to know how your exam is set. You need to know who's setting the exam, and you need to know the mindset of these people. Because once you know, then you know exactly what type of questions come up. So you have the board of assessors. These guys are responsible for setting and marking your registration assessment, right? And the most important thing for you to know is that most of them, probably almost all of them, are pharmacists. right? There are pharmacists from different backgrounds. Some are hospital pharmacists. Many of them are in academia, like your professors. Then you have a few that are non-pharmacists, but they're sort of experts in like online sort of exams and things like that, right? The experts in assessments, right? The assessment experts. The majority of your board assessors are actually pharmacists in different sectors. But we get loads, especially from academia. So you might have some from community, from hospital. It's a mixture. So the first thing you need to know is that pharmacists actually responsible for setting and marking your exam. So this is what happens. Before you get this paper, which you're going to do, what these board of assessors do is they're going to get questions from question writers. So you've got question writers that will actually write your questions. So these guys write a lot of questions. Normally, perhaps each writer may write between 5 to 15 questions. And there's a number of them, and they're going to send all these questions in a secure system to the GPhC. And then they're going to have workshops where they're going to actually review these questions. So just writing the questions enough, these questions are going to be reviewed. So there's a multi-stage review process before you actually do your exams, right? And then from all of these questions, after reviewing them, and the writers reviewed the questions themselves, they have workshops where they do all of these reviews. From those reviews and everything, they then choose what questions you're going to get in your exam. So this is the reason why I'm saying this is one of the reasons why the GPhC exam is so different from all these mocks that are out there. Because these mocks don't go through a multi-stage review process like the GPhC does. Right? Maybe one person might check your two, but the GPhC goes through a multi-stage process reviewed by experts. That's why the questions you get in the exam are more likely to be more concise, more accurate, and less ambiguous, because they go through a proper stage of review, which most of your mocks don't. Right? So the question writers, they send this, and then that happens. Okay. Now it's important you know who these question writers are. Right. So number one, there are pharmacists. That's why I'm saying to you that your questions, most of those questions will be from your daily practice. Right? They will not necessarily just be from memorizing the BNF and things like that. They'll be from your daily practice, because they're testing you on your day-to-day stuff. So registered pharmacists from the UK, they all have to be registered pharmacists. So there are pharmacists that send the questions that you're going to do. Number two, they need at least 1 year of experience. So 1 year of experience as a registered pharmacist. They need to be familiar. So these first ones are ones that they're like obligatory. They're not desirable qualities. These are criteria. This is obligatory. They all have to be registered pharmacists in the UK. That's obligatory. They all need to have at least 1 year experience of being a registered pharmacist in any sector. That's obligatory. They need to be familiar with the standards for trainee pharmacist training and the registration, assessment, specification, and what, guys? Framework. So everyone that writes your exam, they need to be familiar with this, and I'm going to show you exactly why. Because all the questions, they have a structure that is given to them on how they have to write these questions. And when they write the questions, they have to link every question to the part of the GPhC framework that this question refers to. This is the reason why when you hear people say, oh my God, they gave us a question that was not from the framework, that is not true. Because you have to have the question, and then you have to show where from the framework you have to match them together. Right? So they have familiar with the knowledge and skills expected of recently registered pharmacists. And then the last two are desirable. So working in a patient-facing role, which means that you probably get those questions that are linked to facing patients. And then finally, which is not obligatory but desirable, the independent prescribers. The exam is becoming more clinical. That's why I'm saying we're moving from a recall to a more sort of situational judgment, more application-style questions. And that's why critical thinking and analysis is so important. And that's why I'm doing this session, because most people don't do this for you. So guys, this is exactly the people that say your question. This is the background, and that's how they set the questions. So important. Now the next slide will even give you more stuff for you to learn about the people setting your questions. So this is the next slide. So once this is done, this is the criteria of your GPhC questions. This is the criteria. We're going to go through each of them one by one. So questions have to reflect contemporary pharmacy practice. What does this mean? Your questions have to be based on what is happening now in pharmacy, right? Not what's happening 20 years ago. It has to be based. So that's what I'm saying to you. Most of your questions you walk into the exam is not going to be as bad as you think if you've been working in a pharmacy. If you've been working in pharmacy at all, then maybe you might see what was going on. But if you've been working in pharmacy every day, you're going to notice that this exam will be more reflection of what you see every day in your pharmacy, because the questions have to reflect what is actually going on right now in practice. Questions need to, do you guys see this? I think I have to highlight this one because I really want you guys to see this. This is so important, and I keep doing this. Questions align and map to the assessment framework. Okay? They have to align and they have to map this framework. Questions, and then this is so important, and this is what I'm saying, that you could be a master so good at recall. You could learn everything. You could master the BNF. You could memorize the whole BNF, but you still fail the exam. And the reason is because the questions assess cognitive function beyond, you guys see this? Beyond knowledge recall. It's beyond the stuff. It's more than recall. It's really application. All right, so we will do some recall questions because there are a number of recall questions in the exam, but then you will see most of those application questions. So we're going to do both. Right, so questions are written in the formats using the assessment and submitted using approved secure processes, so it's all secure. Questions and answers are accurate, right? This is not a mock. Your mocks are not like this. These are GPhC questions. That's why you have nothing to worry about. Accurate. There'll be no ambiguity. And if there was anything ambiguous about the question, the GPhC, when they're marking those questions, they're most likely going to take that off. Okay, so the questions are really accurate. It'll be very clear. It'll be straightforward. You'll be able to understand this stuff better, right? Unambiguous, there'll be no ambiguity. It'll be straightforward, right? Question construction avoids negative phrasing. Now, this is another thing you're going to have. You're going to have distractors. And once we start doing the questions, I'm going to highlight these distractors so that you could see them. You're going to have certain things that are in the question that are there to distract you, but they're constructed consistently and they do not lead the candidate to the correct answer, but they are plausible. So the reason why this is important, which I'm going to show you guys later on, especially in your extended matching question and in your analysis questions, the reason why many of you struggle is because with analysis questions compared to recall questions, analysis questions normally have plausible answers in them. So you have the correct answer, but you also have a plausible answer that in practice is correct. So that's why most of you then get stuck with those sort of questions where you're like, oh my gosh, I don't know if it's A or B because both of them are sort of correct to me. But I'm going to show you guys how to deal with these questions so you'll be able to go for the best question, right? The best answer. Questions are not discriminatory. And questions, this is a very, very important one as well. Questions, number 10, are usually practice-based scenarios. What does this mean? This means most of your questions will be based, again, on what you're doing every single day in the pharmacy. Right? Most of the time we learn about recall, we sort of focus more about, oh, have you memorized the BNF, this and this and this. But most of the time, guys, these questions are based on the things that you do on a day-to-day basis in your pharmacy, the counseling you're giving. And some of them will be so straightforward because remember, the GPhC is not testing you about your knowledge recall. The GPhC is just testing you about your practice and just make sure that you are safe and you'll be a safe pharmacist. Okay, great. So let's do this together. Let's do this together. Kaz, how are you, Kaz? Kaz is amazing. Kaz on the private session. I see people telling me that car's been stolen. So if that comes up, I'm good. No car's been stolen. All right. Okay. What if option? We've got what if options. If two options are right. Okay. So this is what I'm going to show you in the next coming days. There is always one correct answer in the GPhC exam. But there was more than one plausible answer. That's why when you look at the answer, you see two answers go, oh, this is right and this is right. But that's why they ask you for the most appropriate, the best. And these are what we call prioritization type questions. And that's why we have a prioritization session coming up. Because that's why people struggle with this sort of questions, because most of the time when you look at them, I'm going to show you with examples and you're going to see those yourself. But I'm going to show you the examples where you're going to see and go, oh gosh, but A looks correct and B looks correct. But there's always only one correct answer in the GPhC exam, not two. But there could be more than one plausible answer. So you need to have the skill in order to distinguish which is which. And that's exactly why I'm saying no one teaches you this. I could do a session now where I just go question, answers. Guys, I put a question up. I give you 1 minute. Answer the question. What's the answer? The answer is B. Great. Question number 2, guys, 1 minute, do it together. What's the answer? Yes, these help. I'm not saying it's bad because you want to practice, but it doesn't really teach you the skill, the critical thinking that you need. All right. Marvin, explain point 8 again. Yes, point 8 again, please. Okay, let's go back. Most of these things, guys, I love to explain them with examples. And we are going to come to examples when we start looking at questions. Everything I have for you, I've got examples so that you could see it in action. All right. There's no point in me teaching you stuff without showing you how to apply it. So question number 8, distractors, which you're going to see. There are many things. There are a few things that they may put in questions. They may put them in questions that are not really necessary. They sort of distract. They're just there to distract you. But at the same time, they're plausible. So you're going to see this, especially when we come to the extended matching questions. I'll show you examples where, you know what we're talking about now when we say, oh, there are 2 correct answers. That could be a distractor. You could have a plausible answer. It's plausible, but it's a distractor. I'll show you guys an example. Don't worry. It's a distractor because you look at it and you think this is correct, but it's just distracts you because it sounds right, but that's not the best option. But for you to know how to choose the best option, you need to have a strategy. And this is exactly why I'm going to show you guys strategies. So that with those strategies, you'll be able to choose from the distractors, which is the best answer. Does that make sense? Give me 1, give me 1, give me 1. If you're ready, give me 1. Guys, this is just the introduction. Believe me, what I have for you is going to blow your mind. This is giving you the structure, basic understanding, and then we're going to go into questions. Today, just 1 or 2 questions. Tomorrow is going to be full of questions where I'm going to show you guys these analysis type questions, and I'm going to show you strategies on how to answer them. And then day number 3, we're going to look at more questions so that you look at the different grades of questions. Some guys, in your exam, there will be some questions that are so easy, right? And that's most of your recall questions. And then there'll be some that will be a bit more complicated. And we're going to go through all of this. So I've got Haley says, wow, Haley's got long with febrile patient interaction, gentleman newly prescribed sildenafil, no indication written. I asked what it was prescribed for, then had to listen to him give intimate details. Oh gosh. Yeah, you have those patients. And that's part of being a pharmacist, and we just have to listen. Right? Listening is therapy. We just have to listen to them. Okay, great, guys. Are you guys ready? Right. So I'm not going to give you guys too much because it's 9 o'clock, but what I want you guys to do is now what we're going to do is I'm going to show you something that is the key to pass the exam. The key to pass the exam is on the next slide, right? All of these are keys. Let me show you this so that you see what I'm talking about. Key number 2. So we looked at key number 1, which is understanding your GPhC framework. I cannot go into detail about the whole framework because so much to go through. Medium weighting, you have that. All of you at this stage would have at least gone through your framework. That's how you learn anyway. So I'm not going to go into details. That's not what you really want now. But it's just to show you how important it is to understand the framework, how important it is to know the structure of each question, your single best answered questions and your extended matching questions, and also to know how the questions are structured, to also give you that confidence that GPhC questions are different from these questions that you do in mocks. And one of the reasons is because these questions don't go through the same multi-stage review process that the GPhC goes through. Most of them are ambiguous, and most of them are not as concise and as clear as GPhC questions will be. Okay, that's a fact. Okay, so is that clear? Give me a 2, give me a 2, give me a 2, and let's go into the next. This is why we love Marvin. This is why I love you guys, right? Because I need you to succeed, and I just need to give you the things that are lacking in our education system. Right? I think this is lacking. I think everyone just does questions and answers, but many of you don't even want this question and answers. Most of you are like, listen, okay, you're showing me the answers, but please, I just want to learn how to answer this stuff. I don't just want to know the answer. I want to know how to answer this stuff. I want a skill that I can apply for all questions, and I'm able to answer them. And that's what I'm trying to teach you. I'm trying to give you a skill, which I'll give you, and I'll give you some frameworks that you can use. So when you have any clinical question in the exam or any question, use that framework, and you'll be able to understand and to answer those questions easily. Okay, so let's go, ladies and gents. So the next thing, so learn how to apply. So we'll look at the first key, which is GPhC framework. The second key is learning how to apply your knowledge. Keyword, apply. We are going into application, ladies and gents. This is where things begin to change in a timely manner. We're going to start applying your knowledge now. I'm going to show you how to apply everything you've learned in the exam because that's where we struggle. Okay, so in order for you to learn how to apply your knowledge, you need to understand the difference between a recall question which people don't teach you, and an analysis type question. You need to know the difference between these two. Your exam is going to be a mixture of both. Many students will be fine with these ones because it's just recall. You can literally memorize the BNF and you could answer a recall question easily because you know what? You've memorized that BNF, so you could answer questions easily. Some of you may be able to answer recall questions easily, but you may be an expert with recall questions or you know the whole BNF, but then you're going to struggle with analysis type questions because these require more. These are the questions where you see the GPhC talks about the most appropriate, the most this, the most suitable, the most likely. Those referral questions where you have to make a judgment. You're stuck on those two answers. It looks like they're plausible answers and there are correct answers in the question. This is the area where students struggle the most. So this is going to be a very big focus. But before we get into that, are you guys ready to see what a recall question is? The difference? Give me a one. Give me a one. Let's put things in the practice, ladies and gents. And then we could round this up and continue tomorrow. Remember, tomorrow we're just going to do questions. We're going to do a series of more recall questions, and I'm going to show you guys analysis type questions. Once you understand the difference, once you leave this webinar tonight or this session tonight, you already start seeing this in your papers. And the first thing you'll be thinking about when you look at a question, you think about structure. You ask yourself, is this a recall question? Is this an analysis type question? Okay. And that would then, you know what strategies to use to answer which question. So let's give an example of a recall question. So first recall question is this one. So that's a recall question. So see if you could do that question. Give you guys a few seconds. So with recall questions, which you're going to get an exam, they tend to be shorter. The scenarios tend to be shorter. Remember, we have a scenario, we have a question, and we have our 5 options. Single best answered questions. That's why I showed you guys the structure before. So the scenarios tend to be shorter. The questions, you don't see as many words in there as most likely, but I'll teach you guys all of this stuff when we come to prioritization. So these are not prioritization questions, and these questions don't require critical thinking. These questions just require recall. So if you're an expert in recalling stuff and memorizing stuff, you have no problems with recall questions in exam. So what's the answer to this question? Again, remember, guys, it's not really about the answer. I'm not really trying to test your idea, stuff. I'm really trying to teach you skills to apply. So I'm getting loads of 30s, 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 30s. Fantastic. So it's an example of a question. This is from the GPhC website, by the way, right? So this sort of question is something that you could learn from your MEP. But many times you can learn this just from practice. Just by working every day with your control drugs, you can know this. So there's going to be many questions that are based on practice as opposed to, even though you have that information in the BNF and your MEPs, but it will give you that question more based on practice. So this, how many guys found that question easy? Give me one. If you found that easy, if you found that straightforward. If that's a question you thought, wow, maybe I could do this question in like 2 seconds. Give me. Type of me, type of me, type of me. So this is going to be the easiest type of questions you're going to get. Guys, it's going to get a bit harder than this, I promise you. But I want to take it step by step. So you're going to get these are examples of recall questions. Right? You don't need much. You just need to memorize. There's no analysis. There's no results. There's no interpretation. There's no guidance to use. There's literally no PMRs involved. These are straightforward questions. I'll give you another example. This is another example of a recall question. So the recall questions will tend to have very short scenarios. There'll be memorization. You don't have to analyze. You don't have to do any of these things. The question is there. So what is this answer, guys? What do you guys think? Uze. Uze says, I would love if the whole clinical paper was like this. I know everyone would love that. You know what? Previously, and this is what I said to you guys, I really want you guys to understand. Many years ago, even when I did my exam, most of the exam was based on recall type questions. Right? So in a way, we used to do exams where we used to take our BNF into the exam. We used to tag our BNF. And so it was about memorizing this stuff. And it was all about recall. But the exam questions and structures changed. They're becoming less recall and more analysis and interpretation type questions. Okay, practice-based questions, scenarios. So that's why it's so important that you attend tomorrow, because we're going to go into this. So I'm getting a middle roll, I'm getting A, fantastic. So you just got reading control, you memorize that stuff, you know that stuff. Some of you might use mnemonics from the course. Brilliant. So you're going to get a number of these questions in your exam. Not all questions will be difficult. Let no one fool you. You have 120 questions and you have a lot of easy recall questions as part of the exam. Standard, okay? You have many questions where you just go in there. It's going to be a very short scenario. It's going to be just one line question there and a list of answers, which I've shown you guys the structure, and you'll be able to answer them. The secret to answer these questions is definitely memorizing, doing a revision, learning the side effects, memorizing the stuff. That's fine. The next type of questions which we want to look at, which is analysis type questions, are the ones that may challenge many of you. And these are the ones that we're going to focus on. So before we end this session, I'm just going to give you guys one example. I'll give you one example of the type of questions we're going to do tomorrow, which is an example of an analysis type question. Okay, an analysis type question. You guys want to see an example? Give me one, give me one, give me one. Again, remember, I'm not here to teach you content. I'm not here to like test your answers. I'm here to make sure that you understand strategies of critical thinking. Okay. Uza says, I felt last June clinical wasn't too bad after joining combo course. Great, Uza. Thanks for saying that. Thank you so much. I appreciate that. So we're going to make it even better for you. This video exam, I'm going to make it a lot easy. So are we all clear with recall questions? Give me a me, give me a me, give me a me. Give me a me if we're all clear with recall questions. So these are easy ones. These are straightforward ones. Most of you is just memorizing. So the next one I'm going to show you now is an example of an analysis question, and we're going to do more of this tomorrow. With analysis questions, you need to use a strategy to answer them, and I'm going to show you guys a formula that you're going to use with analysis questions, and I'm going to show you exactly how they come up. They normally have most appropriate this, most appropriate that, extended matching. I'm going to show you guys keywords to look out for so that you can know straight away that's an analysis type question, and then you have the formula that you can apply and answer the question. Tomorrow, I'm going to show you guys the formula, and I'm going to actually use the formula with examples of GPhC questions so that you see how we, oh, that's my mic, so that you see how we break them down and we see how we apply this. So let me just show you guys an example. I'm going to stop sharing this. I'll just share an example. We're not going to go through the answers now because we're past 9, but I just want you guys to just have an idea of a difference between this type of question. So let me stop sharing this and let me see if I can share something else. 411 of us. Wow, that's impressive. No one has disappeared. Let me see if I could share something else with you guys. Let's see. Let me know if this is sharing. Let me see if this is sharing. Okay. So this is from day 2, which is going to be tomorrow. Can you guys all see the question? Give me one. Give me one. Just look at this question and just see if you can answer. I'm not going to get your answers now. You can put your answers down, but I'm not going to give you the answers now, because we're going to continue this tomorrow. This is an example of an analysis question. And tomorrow I'm going to break it down for you so that you know what an analysis question is. You normally have like a subject in there. You're normally going to have a number of drugs in there. You're going to have like some conditions, comorbidities in there. You're going to have those options. You're going to have most appropriate. You're going to have words like most appropriate, which shows that it's prioritization strategies. You're going to have some conditions. But tomorrow, guys, between tomorrow and Wednesday, I'm going to break this down for you in detail. I'm going to show you how to answer these questions, what to look out for, how to think critically with GPhC questions. And once you start using this framework, everything will be easy for you. You're not going to look at questions that you look at them now and think, oh my God, do I know this stuff? Or can I remember this stuff? You're going to literally take a question and like, okay, that's fine. Let me break this down into using this framework. Bang, 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 bang. Answer, most likely, this is the answer. Boom. Next question. And you'll be able to apply this not only in the exam, but in practice. Okay, great stuff. So this is an example of an analysis question, and this is what we're going to focus on tomorrow. Tomorrow, we're going to do analysis